Since the start of the war in Ukraine, pregnant women have been under extra pressure, especially when taking cover in shelters and basements. Doctors say premature births have been notably higher in regions where active military operations are conducted. Getting the right support, be it warmer surroundings or breathing apparatus to babies born early, has been a huge challenge, not least for international donors supplying British-made equipment, as Mark Lobel has been finding out.
Another day, another air raid siren at this children's hospital in the west of Ukraine. It's not an unusual sight to see children and mothers hunkered down in the bowels of the building here. Earlier in the war, over 100 mothers and children crammed into this bomb shelter in the capital, a makeshift maternity ward for those giving birth and their new arrivals. But the stress of war is having a profound effect on expectant mothers too.
The war increases levels of stress in pregnant women, which leads to an increase in the number of premature births reported, up to 3 times more than before the war.
Babies that may find it harder to breathe, digest and function normally, and if not helped, will struggle to survive. There can be up to 3 enforced trips to this shelter a day, so doctors in Kyiv are now transforming it into an intensive care neonatal unit for premature births, reliant on innovative life-saving British-made equipment donated by the government of Jersey.
It can provide also an observation for the baby and adequate climate for the baby. This is for the children under 1,500 grams.
So far, at least 26 incubators have been delivered to Ukraine, with 30 on the way. But it's estimated up to 400 may be needed to meet demand.
They are transportable, so as and when a hospital is shelled, children can be taken underground very quickly.
Fergus, in areas where incubators haven't yet arrived, what other life-saving methods are being used to keep premature babies warm?
So really you're going back to being able to do skin on skin and really close support from the health community, but that's very, very hard and challenging.
So these are the different parts of this CPAP device.
The other thing these premature babies desperately need to survive is breathing support, as demonstrated here. In other words, oxygen. The UN has provided over 200 of these portable nasal devices in 25 locations across Ukraine, supplying pure oxygen for less than $500 each.
Having very portable devices that can function offline is absolutely critical.
These are the war babies, all born at this hospital since Russia invaded Ukraine. For their mothers, bundles of joy in a situation full of anything but. Help is on its way, but the situation remains critical. Mark Lobel, BBC News.
Yeah, really challenging times. That is war, isn't it? And we wish them all the best as they look after those little people. But